Psoriasis is a chronic inflammatory skin condition in which skin cells multiply much faster than normal, leading to thick, scaly patches on the skin. It is not contagious, but it can significantly affect physical comfort, emotional health, and quality of life. Now, today we will understand psoriasis from Ayurvedic perspective. In Ayurveda, the first line of treatment is always avoiding the causative factors. Hello everyone, I'm Dr. Priya Sharma and today we are going to take a detailed look at psoriasis. Now let's look at the causes. Number one, incompatible foods. Regular consumption of incompatible food combinations is a major cause of psoriasis. For example, tea with salty snacks or milk combined with fruits or milkshakes. Now occasionally if you take these are not going to harm you, but a regular consumption disturbs your digestion and leads to skin diseases like psoriasis. Number two, the second cause, important cause is consumption of excessive liquids, fried food and oily food. Excessive intake of water, juices, soups and frequent consumption of fried and oily food weakens the digestion and metabolism, leading to toxin formation, toxin accumulation and skin disease like psoriasis. Third reason is eating heavy to digest foods on routine and regular basis. Now what are these heavy foods? For example, sesame seeds, jaggery, urad dal, curd. Now these all slow the metabolism and cause toxin formation and in turn leads to formation of psoriasis or skin disease. Fourth important reason is opposite or extreme combinations. For example, drinking very cold water immediately after exposure to hot sun. Second is exercising after heavy food intake. These disturb the digestion and promote toxin formation, thereby affecting the skin. Fifth causative factor of psoriasis is suppression of natural urges. Suppressing urges like vomiting or bowel movements disturbs the internal balance and can lead to skin disease such as psoriasis. Number 6, sleeping during the daytime weakens digestion and increases toxin accumulation, thereby aggravating psoriasis. Number 7, genetic factors. Psoriasis can run in families and genetic predisposition plays a very important role. So if your parents are suffering from psoriasis, there is a high likelihood you might get it as well, especially if you are following the above mentioned causative factors and routines. Number 8, emotional disturbance. Stress and anxiety can trigger psoriasis and psoriasis itself can further increase your emotional stress, worsening the symptoms. Now let's talk about symptoms based on dosha dominance. If the vata is dominant, the psoriatic patches will be dry and dark. If there is pitta dominance, there will be burning sensation, redness and discharge. Whereas if there is kapha dominance, there will be thickened skin and heaviness. In psoriasis, skin cell turnover becomes excessively fast, leading to scaling and plaque formation. A serious complication is psoriatic arthritis, which causes joint pain, inflammation, as well as mental stress. Now let's talk about Ayurvedic treatment of psoriasis. First part of the treatment is avoiding the causative factors. Avoiding all the causes we have already discussed is the most important and first step in treatment of psoriasis. Number 2, medicated ghee. Intake of medicated ghee like Mahatiktaka Ghrita is very useful, especially in vata dominant psoriasis. You can add 1 teaspoon of this ghee to warm water and drink empty stomach in the morning once and night once, 1 hour before your dinner. Third thing that plays a very important role in treatment of psoriasis is panchakarma therapies. Therapeutic emesis or vamana therapy is extremely beneficial for kapha dominant psoriasis, whereas purgation or virechana and bloodletting therapies are good for pitta dominant psoriasis. Panchakarma removes the accumulated toxins, helps prevent recurrence and should be followed by medicines and lifestyle correction. Number 4 that you can do is stress reducing therapies like oil pouring therapy or shirodhara on the forehead and nasal medication therapy or nasya therapy, which helps reduce stress and anxiety. Now, there is a role of bitter tasting medicines in psoriasis. It's a very important role. So, bitter based medicated ghee, that is tikta rasa pradhana, like maha tikta ghrita or tikta ghrita, 1 teaspoon with warm water, empty stomach in the morning, can be taken. Neem decoction for bathing is highly recommended. Neem-based dental cleaning helps in absorption of neem via oral cavity, which thereby helps in psoriasis. Bitter gourd cooked in ghee is highly beneficial and can be consumed every day. Now let's talk about certain medications which can be taken based on the presentation and dosha dominance. For example, if there is pitta dominance, licorice or muleti powder, half teaspoon twice a day can be taken before food with warm water. Kamdudha ras, 2 tablets twice a day as per severity can be taken, and avipattikara churna, 1 teaspoon at bedtime with warm water, helps support intestinal cleansing and reduces excessive heat from the body. If you suffer from psoriatic arthritis, Dashamula based preparations like Dashamula Kwatha or Maharasnadi Kwatha, 15 to 20 ml with equal amount of water can be taken twice a day. Panchtiktak Gugulu, 2 tablets a day post meals can be taken. These dosages are merely indicative and must be individualized according to severity, constitution and clinical presentation. So always consult your Ayurvedic doctor before you decide the dosage and the medicines. Stress management is an important aspect of psoriasis management. For stress and anxiety, Jatamansi based medicines can be taken. For example, you can take Jatamansi powder, soak half teaspoon of it in 1 cup of water for 3 to 4 hours and drink this after filtering before bedtime. Brahmi based formulations like Brahmi Vati are also very useful, and Nasya therapy with warm Anu Taila or warm cow's ghee, 1 to 2 drops in each nostril, is highly beneficial. Prevention of recurrence is very important in psoriasis because the recurrence rate is very high if you are not taking care of these things. So, you should have Rasayana or rejuvenative therapy in continuation. You can have Indian gooseberry or amla and classical Rasayana formulations like Chavanprash, Amalki Rasayana, etc. They are highly recommended. Now, let's talk about local application. If there is itching and burning, local application of neem oil should be done. If there is dryness and dark patches, castor oil should be applied, and if there is burning and redness, Shatadota Grita should be applied. Now let's talk about certain dietary guidelines, what to avoid and what to take. So you must avoid very sour, spicy and salty foods. Excessive salt intake should be restricted. Milk, curd, urad dal, sesame seeds, jaggery, all these should be avoided. And now what to include, what to take? You can include Indian gooseberry or amla, sweet pomegranate, rock salt instead of your regular salt, green gram, pigeon peas, lentils, rice and wheat can be taken. Triphala can also be taken on regular basis. Eat only laghu ahar, means easily digestible, simply cooked food should be consumed. Psoriasis is not just a skin disease, it reflects your digestion, your lifestyle, as well as your emotional balance. Ayurveda focuses on correcting the root causes, not just suppressing the symptoms. So share this video with anyone who might need it and subscribe to my channel for more such authentic Ayurveda videos. Thank you.